Okay, so we're back and we're ready to start our CIT treatment. CIT is collagen induction therapy. So what I've done with Jen is I actually double cleansed her. I used a prep on her skin to make sure there's no oils left on it, and I, as well as putting a pumpkin definer, which is a little enzyme that's going to eat away all that surface dead skin cells to kind of just give us a nice canvas to work with. I'm going to be using through the whole treatment this vitamin C with hyaluronic acid, vitamin E, and ferulic acid. What the combination of those three acids are going to do, it's going to infuse into her skin when I'm using the CIT pen. So I'm going to put a first layer on her skin now, and then I'm going to work in sections and add some of this vitamin C serum. So with my 3 treatment series, you'll get a bottle of this when you go. If you only do the one treatment, you can purchase this separately, which is good for everyday use anyway. In fact, I use it at home all the time. All 3 acids are incredible at collagen synthesis and building collagen and lightening and brightening and evening out the skin tone. So I'm going to do that, and I'm going to take a little bit of this, and I'm just going to put it throughout. Now this shouldn't feel like anything, and actually should feel nice and hydrating and moisturizing even. The hyaluronic will do that. And with the CIT treatment, we want to keep the skin hydrated as we move along. So we'll do this initial on her, and then we're going to start on the forehead, and then I'll have a little more as we go along. So most people can do a CIT treatment. People who can't do it is people like with eczema, active acne, fungal infections, scars less than 6 months old, facial fillers in the past 10 days, scleroderma, vascular diseases, blood clotting problems, things like that. Other than that, pretty much anybody can use this treatment. So I'm going to take the CIT pen, and I'm going to put it on a cosmetic. I need that light, Becca, sorry. I'm going to put it on a cosmetic setting. Oh, sorry, needed some more light here. Let me find that cosmetic. So I'm going to put this on a 05. Right now I'm using if you can see that, a 36 point needle head to start on her forehead. Okay? And I just put some extra vitamin C on her, and I'm going to go in small little circles. Jen, how does that feel?
It feels like if you were to take sandpaper.
Okay, perfect. How's your comfort level though? Right now, okay?
5 to 10.
Maybe a 5.
Okay. That's kind of where I want it to be. So we can always take a break if you feel like it's becoming too much, okay?
Mm-hmm.
And I'm going in small circles, and all that 36 point needles is basically creating a wound in her skin. Do you see how red she's getting? And what that wound is going to do is make the skin respond and go, bring oxygen, bring blood flow, bring all this healing stuff so elastin and collagen can reset itself. It's also, Jennifer's got a little hyperpigmentation right here. It's also going to break that hyperpigmentation up, which is going to leave her brighter and tighter. Still about a 5, Jen?
Mm-hmm.
The nice thing is your body's going to start to get used to this feeling.
It definitely, some areas are
worse than others.
Yes.
Like this is probably not as bad as what I just did on your temple, right?
Right.
Yeah.
Out of 10, how red should she be getting?
Everybody's different. Good question. Jennifer is really not as red as I expected her to be. I got super red, but you see how it kind of is giving you this sunburnt look?
Yes. I remember when you did it on yourself, you were quite red.
I was quite red, yeah. I'm just going to add, I'm going to start on this side, add a little bit more serum. Yeah, so it smarts a little bit. It definitely is uncomfortable, but you don't want to cry, right, Jennifer?
No,
yeah,
not at all.
Yeah. So people always ask me, is it uncomfortable? Yes. The answer is yes, it's uncomfortable. But it's not where you...
I definitely couldn't do it with my eyes open. Like, to squinch my eyes a little bit
is helping.
Yes.
Jennifer's right. Some places are going to be a little bit more sensitive than others. The nice thing about the CIT treatment is that I'm working quite fast, and that's going to help the overall process. And that's why I tend to do it in circles as opposed to a crosshatch technique, which some people use, because I think the circles cover a lot more bases quicker. See how red she is?
The camera is definitely showing it more red than it actually is. So it's not as red as it.
Okay, so this part's probably going to be a little bit more smart. It's going to probably be a little bit more uncomfortable, so I'm going to work pretty quickly.
It's actually not.
Okay.
The bone area.
The bone area.
Yep.
So this part's okay.
Mm-hmm.
All right. Now that's funny. This is where I kind of felt like it was a little intolerable. Isn't that funny?
Mm-hmm.
Now you want to do about 4 passes in each section. That just really gives the body, the epidermis, the trigger point to say we need repair done. We need to repair the skin.
I know you did it on your scar, but did you bring it down to your neck?
Yep, I did bring it down to my neck, and I'm going to bring it down to Dee neck too. I'm probably Jen's neck. I'm probably going to not show that on film, only because for purposes of making the video shorter, I'm just going to do her face.
This doesn't hurt at all.
Okay, good.
There's zero pain.
I do also think that... But you feel it, right?
Yeah, I feel it.
Okay, so you're feeling the needles in there.
Yes, it's more of like a sandpaper.
Yes,
feel.
That's exactly how I felt it was around this area. I just wanted to make sure that head was in there correctly.
Yeah,
I was like, but you do feel it, right?
I do feel it. Yes, ma'am.
All right. So I could adjust the setting. I'm not going to for Jennifer's first treatment because she's feeling pretty comfortable in the treatment right now. But if she was feeling too comfortable and I wasn't seeing this redness that was coming up, I would actually take this up a little bit.
By the bone is more
the
discomfort.
Worst.
Yes.
I would actually take it up in the setting a little bit just so it would get a little deeper. But for purposes of this video, I'm not going to do that.
Like you said, it definitely does look like it's a sunburny red.
A sunburny red, yep.
But the camera is showing it looks worse than it actually looks like.
Good. And I just keep adding the vitamin C serum because that's getting pushed into deep into her pores, which is only going to give her a better result. How does that area feel, Jen?
A little,
yeah,
I would
a little
say
sharper
3.
than over there. Mm-hmm. Actually gonna bring this up just a bit for her since she's feeling a little too comfortable. You see how her forehead got a lot more red than this area here? How does this feel?
I feel it more so.
But tolerable?
Mm-hmm.
Okay. Because at the end of the day, I want you to get a good result. So I want to adjust it to your comfort level. And all in this cheek area is where you have those larger pores. that will totally reduce. You all right?
Mm-hmm.
Or is it too much?
Nope, it's fine.
Okay. Now I'm not even putting a lot of strength, you know, into the pen. The pen's basically doing the work itself. I'm just scrolling it around. So I'm not putting a lot of pressure onto your skin. Do you feel that?
Mm-hmm. I also feel my face heating up a little bit.
Yep.
Like I can feel the redness.
The blood flow is definitely flowing. It's definitely you're definitely getting that sunburnt look. Oops. No extra charge for me hitting you with the thing. Fingers are definitely slippery because of the vitamin C serum. So it's definitely getting the look that you're wanting. So actually, it's probably going to take me another 20 minutes or so to finish her up.
That part.
We'll come back and show you some pictures of what she looks like afterwards. So thanks for joining us.